So it's a really interesting time in feline infectious diseases right now, both diagnostically and therapeutically. So the things that are most compelling and interesting to me are involved with three really common feline infectious diseases that everybody sees. So I know all of you will be interested in this. The first would be retroviruses. So we have just been able to put together some interesting data that confirms there is a strong correlation between cats that have oral inflammatory disease, like your common stomatitis, gingivitis cases that I know we all see, and the risk of those cats having either feline leukemia virus or FIV. So we had some preliminary data published in the past that suggested that we really should be proactively testing those cats. And we've just finished, my research group has actually just finished a data set that will get published in the near future that has confirmed the findings of other groups. So we will be looking at making some recommendations to practitioners about being proactive about screening cats with oral inflammatory disease for feline leukemia and FIV. So it's exciting to see something that we thought was a real phenomenon actually get confirmed. Another really exciting thing that is way overdue, and it's amazing how long we've had to wait for some good news on this front, and that's with FIP, with feline infectious peritonitis. So we were finally seeing some really novel approaches to understanding the biology of that disease, and that's going to give us some interventional targets to look for new therapies. So coming out of the University of Tennessee, coming out of Cornell University, we've got some wonderful studies, a lot of these funded and supported by the Win Feline Foundation, for example, that are really unraveling the secrets of FIP. So we do have finally some therapeutic products out of the University of Tennessee that are in trial that look really promising from a variety of approaches, both to modulate the immune system and to interfere with replication of the virus. So I think we're on the verge of having some big news in the not too distant future, of finally some good news to help us with those patients with FIP. And probably the third thing that I think is fairly interesting and exciting is that we have a new drug with a conditional license for treatment of upper respiratory tract disease in cats. And that drug is called polyprenyl immunostimulant. Many of you might be familiar with it because it's also been used in treatment of cats with FIP, so we are excited about that. But its conditional license is for treatment of cats with upper respiratory tract disease. So it's a drug that's given orally. It's in liquid form that's given orally. It's licensed for 15 days of use, and it has some very interesting preliminary data. So we'll be really keen on seeing how that performs in our patients, particularly with acute flare-ups or their first onset of respiratory tract disease, often herpes virus-driven, for example, in cats, and to help us try to get control of those patients early on so they don't end up being kitties with chronic sinusitis or rhinosinusitis. So I think we're finally on the verge of having something that really shows us some promise in preventing us from having chronic problems from these cats if we can intervene and use it early.